Hi everyone, this is Group 5 and the topic we picked is the cholera outbreak in Haiti in 2022. According to CBC News, last year in October, the waterborne bacterial infection, which can lead to the rapid onset of severe diarrhea and dehydration, caused at least 35 official deaths, with more than 600 suspected or confirmed cases surrounding the country capital. In addition, there have more than 200 suspected cases in total linked to the prison. Transmission of the bacteria causing the potential deadly illness is closely linked to the inadequate access to the clean water and sanitation facilities, and is often worsened during the time of humanitarian crisis. Street violence and increasing in the fuel price due to shortage negatively influence the success of the medical care. World Health Organization is giving help, and the international investment will support development for the long term. This topic is important to nurses and other healthcare professions is because cholera is contagious and easy to spread widely if the country is struggling to provide proper medical care. The contagious disease can be repeated among the poverty countries and lead to a high amount of death. According to the World Health Organization, cholera has been a concern in Haiti since 2009. And in 2010, there was an outbreak due to the earthquake. For years, Haiti was thought to be cholera-free with effort. However, with the unstable, ongoing social unrest and infrastructure challenges this country facing, there was bound to be another public health crisis. In this presentation, we will discuss the current situation in Haiti and the future prevention.
In the cholera surges in Haiti, the author Daniel illustrates that cholera breakout is occurring in Haiti along with political and security crises that are present. There have been 924 confirmed cases, 10,671 presumed cases that all led to 188 cholera deaths. When the epidemic initiated in Port-au-Prince, approximately 40% of the cases have been reported to be children according to the United Nations. In account of the past outbreak, they do not have a strong immunity. 4.7 million individuals suffer from severe hunger because of malnutrition, whereas obstruction from gas affect access to healthcare and fuel supply. Response attempts are hampered by security concerns and the increase of misinformation in cholera. The matter is made more difficult by a global undersupply of cholera vaccinations in endangered locations. Better waste management and cleanliness are essential. In the middle of several crises, cholera is still a serious problem in Haiti. Next, looking at the cholera vaccines, ration and mid global shortage article by Debbie. The increase in infections have prompted to switch to one-dose approach due to a global lack of oral cholera vaccinations. The adjustment was made by the International Coordinating Group, which is in charge of monitoring vaccination supply, in reaction to an unexpected increase in demand and a shortage of producers. Cholera continues to be a health worry, impacting populations at risk. Debbie mentions for maximum immunity, it is best to take 2 doses of the cholera vaccination. The ICG had been prepared for cholera outbreaks by storing vaccines, saving 5 million doses, and continues to work with new manufacturers for the vaccine.
Two main philosophical approaches were used to present the information about the cholera outbreak in Haiti, and these are phenomenology and critical social theory. A phenomenological approach was used to present the lived experiences of the inmate and how this has contributed to the cholera outbreak. According to CBC, over 4,000 inmates are imprisoned in Haiti's National Penitentiary located at Port-au-Prince. Amidst overcrowding, unhygienic living conditions, poor sewage system, lack of clean water, living with dead cholera patients, inmates must deal with inadequate medical care consisting of low medical staff and medicine. These problems are facilitated by the Haiti prison system and the government. The lack of adequate social, economic, and political infrastructures to reduce the cholera outbreak can be blamed on the government, and this encompasses the critical social theory approach. According to Daniel's article, it was pointed out that violent gangs and fuel shortages prevented optimal healthcare services. The critical social theory approach presented the marginalized group of people living in overcrowded slums and the oppressed Haiti prisoners as being denied right to health because of fuel shortages and street violence.
Haitians have faced many difficulties with the cholera outbreak. According to the CBC News, the death toll is mounting in a growing cholera outbreak in Haiti, all while the beleaguered Caribbean country grapples with gang violence, crumbling infrastructure, and widespread of social and political unrest. As this outbreak is occurring, Haiti is faced with numerous ongoing issues. The cultural component is how the historical, political, social, and as well as the cultural aspects come into play and how the Haitian people are facing the challenges of this outbreak. Looking at Haiti's history, the Haitian population has faced many challenges, including slavery, colonization, and fighting for its independence. Haiti is also facing a political crisis with no elected government after the assassination of the president. The vulnerability leads to misleading information concerning outbreak due to the people's cultural beliefs. Haiti's population also suffered during the outbreak as there was an unequal share of clean water, sanitation, and health care. The nutritional crisis in the country has had an impact on 9 out of 10 cholera cases, according to the UN organization. Looking at Haiti's population, nearly half are suffering from severe hunger as a result of living in poverty, and they are invested. The cultural aspect becomes important, realizing how the historical factors affect the sensitive population in Haiti today, which interconnects with facing the unprecedented outbreak. As treatment facilities are becoming crowded and political and security challenges grow in Haiti, it is difficult to respond to the cholera outbreak.
Having a shortage of the oral cholera vaccine, a shift to administer 1 dose instead of 2 doses helped manage emergency supply. The cholera vaccine is demanded by low-income countries, and the cost range for the vaccine is $1 to $3. Higher and middle-income countries are not as exposed to cholera, therefore there is little financial motivation to produce the oral cholera vaccine. With the shortage of the vaccine and an increase in demand with more severe outbreaks around the world, this leaves Haitians vulnerable, not knowing how long immunity is with 1 dose. Haiti is being marginalized as they are being disempowered by the healthcare they receive. The outbreak in Haiti may not be as severe, but it is jeopardized as there is less vaccines available. Haiti being a low-income country, therefore manufacturers are not financially motivated to produce more vaccines, leaving a small number of manufacturers that produce it. In Canada, cholera cases are extremely rare as it's only been linked to traveling abroad. The transmission of cholera has been closely related to poor access to clean water and sanitation facilities, and is aggravated during times of humanitarian crisis. According to the World Health Organization team leader, Philip Barbosa, it's unacceptable that in the 21st century, people are still dying from an easily preventable and treatable disease. This is seen to be directed towards poor sanitational countries. Many countries like Haiti are not able to receive the treatments or the action plans that can help prevent the disease. This is seen as cultural privilege as they are directing this comment to countries that have more accessible resources.
In addressing the cholera outbreak in Haiti, nursing implications include educating and providing care to patients while navigating challenges. Jean William mentions the impact of fuel shortages caused by gang blockades on the cholera outbreak, indicating the necessity for nurses to address logistical challenges affecting medical care access. In the majority of the detention centers in Haiti, inmates do not have access to medical care and medicines, leaving them at risk during medical emergencies. Healthcare workers and nurses should be encouraged to provide care and education in detention centers. UNICEF also warns that children account for nearly 40% of Haiti's cholera cases, emphasizing the need for pediatric care as highlighted in the first article. The global shortage of cholera vaccine necessitates a strategic approach for nurses. With the 2-dose cholera vaccine, immunity against infection lasts 3 years, according to the World Health Organization. Evidence for how long immunity lasts with the 1 dose is still unclear. However, even with limited protection, it will allow more people to be vaccinated should the outbreak escalate. With the shift to 1-dose strategy, nurses can focus on optimizing vaccine distribution and ensure supply reaches the most vulnerable areas. The decision by Shanta Biotechnics to stop supply adds another layer of complication. Nurses can work with healthcare authorities to explore alternative suppliers on vaccine.
Nurses can play an important role in community engagement, promoting basic wash practices to prevent the spread of cholera. In conclusion, cholera has been a significant public health concern. Nursing implications have revolved around prevention, treatment, and community education. Thank you, class, for watching our presentation outlining the cholera outbreak in Haiti.